All right. Good evening, Facebook and Periscope. Also, our YouTube family. Good evening to you. Just wanted to welcome all of you and thank you once again for coming on. And to give you a few moments as you join in to share on your various social media platforms. Share the broadcast tonight. This is part 5 of a 6-part presentation with Dr. Mark Browning. So we want to have a great audience tonight as we continue the topic of trauma from a clinical perspective with Dr. Mark Browning, a believer, but also a professional in the area of mental health. And we're so blessed to have him to share his expertise on this platform as we are doing our best to provide relevant resources that, in fact, will help infuse the body with the purposes of God. And information is important, but not just general information, information that's tailored to specific spheres of expertise as well. Sharing with a friend of mine earlier today in conversation, if a nation is at war and the warfare is on the waters, you don't want to consult with a nation that only has an army that fights on a physical plot of land. You need a nation that can partner with you, that has expertise on the waters as well. And so it is good to have relationships that touch various spheres where individuals have developed a savvy and acumen that leads them to be sound and a formidable resource. And so we're going to be blessed. Just want to share with you as well before we bring Dr. Mark on concerning the plight of children. And when you look at the historical narrative of God's covenant people, in every generation, there were attacks, opposition, indifference. There were things deployed to impede the progression of his people covenantally. And you can see sometimes the powers of darkness being most incensed against the younger demographic. We shared this in a previous broadcast um, when Egypt held Israel in captivity, and when God began to bring them out, there was a systematic assault released by God upon the oppressive powers ruling in Egypt. And you could see how a part of that, the imprecation or the judgment released, impacted the generation where the firstborn was to be dealt with, because Israel was deemed as God's firstborn. And then you see where God speaks to a prophet named Jeremiah and gives him a prophetic word concerning the time of Christ, that Rachel would refuse comfort because her children were not. And the historical narrative of Christ's birth, under the rule of a guy named Herod, there was a wicked decree made to slaughter all male Jewish babies 2 years and under. And interestingly, there was a lamentation taken up in Israel, and there was such a weeping and wailing because of the full-blown assault that was upon the children of that day. And when you look at even wicked regimes throughout the progression of history, it appears to be that children pay the greatest price, especially in the area of suffering, because within every generation, there is potential to shape the future in a holistic manner. And whoever can control the mind, the overall thought of that generation, can also have tremendous impact upon the future. And taking this into consideration, some of the just ominous things that have been released against society that have led to the debilitation of our children, from traumatic experiences to the disorders that Dr. Mark was speaking about in our last time together this past Friday, to the abuses, whether physical, emotional. It's just a myriad of problems. But then when you look at how humanity has benefited from cultural shifts, you can see that within that demographic of 18 to 30, that they have been used throughout history to help push change. Some of our greatest advancements from a civil perspective has happened by young people. And just as recently as the year 2000 turning, and just some things that have happened across the globe, you see where there were movements of young people that really push societal and cultural change. And just within recent times, with the Arab Spring uprising led by young people, and just the historical narrative of just things that brought reform were orchestrated by those of a younger demographic. And the challenge with helping them to navigate and remain healthy emotionally and remain healthy from a psychological perspective is no small order. And so I salute professionals like Dr. Mark, who in fact has given himself to study and to also be a legitimate source to help impact change within the sphere of influence that he has. And so let's listen attentively tonight. Let's believe God for our children, our grandchildren, our nieces and nephews, and those that are within that demographic of 18 to 30. And let's believe God for an impartation of some practical wisdom. Perhaps we can develop some schematics personally, where we can not necessarily profile, but at least just have a working knowledge of what we're dealing with. We can pray effectively and then perhaps direct them to the right resources. So, people of God, at this time, let's receive Dr. Mark Browning as he comes on to share in session number 5. Good evening, and thank you
Good
so much,
evening.
Dr. Mark, for being with
Good
us.
evening. God
Right?
bless.
Okay.
Glad to be here.
Yeah. Yours, and we'll catch you at the end of your presentation.
No problem. We'll do. We'll do. Fantastic. Welcome to everyone tonight. Blessed to have another evening and opportunity to share some things about psychology and mental health concerns. And tonight, we're going to talk about the issue of substance use and abuse and addiction. So with that, I'd like to start with a little video to start us off with.
If you are thinking of seeking treatment for yourself or a loved one, you are not alone. The number of people suffering from addiction in America is astounding. Let's take a look at some numbers, starting with adolescents. It is estimated that in 2017, approximately 4% of the American adolescent population suffered from substance use disorders. This equates to 992,000 12 to 17-year-olds, or 1 in every 25. Of these adolescents, 741,000 suffered from illicit drug use disorders, and an estimated 443,000 suffered from alcohol use disorders. About 1 out of every 7 young adults aged 18 to 25 battled a substance use disorder in 2017. This age group has the highest percentage dealing with substance use disorders, at an estimated 14.8%. The most common substance use disorders in this population were alcohol use disorders. 10% of individuals in this age range have alcohol use disorders, which equals over 3.4 million young adults. The second most common were cannabis use disorders, and substance use disorders involving prescription psychiatric medications were third. Among Americans aged 26 and up, over 13.6 million struggled with substance use disorders in 2017. This is about 6.4% of that age group. In this age group, substance use disorders were more common in men than women, with an estimated 8.7% of men suffering from substance use disorders, compared to an estimated 4.2% of women. It is estimated that over 1 million Americans aged 65 and up suffered from substance use disorders in 2017, which equates to about 2.1% of this age group. 978,000 of these older adults had alcohol use disorders, and 93,000 had illicit drug use disorders. Addiction affects people from all walks of life, but it is a treatable disease. Recovery is attainable. If you or a loved one is suffering from addiction, seek help.
I guess as a professional, I'm always amazed at the numbers nationwide, not just of mental health disorders, but of substance use disorders and the impact that they are having on our communities. We can see it every day. There's stories in the news daily, whether they be about death or difficulty that's happened that substance use was related to in motor vehicle accidents, or the issue of overdose or opioid addiction and the impact that it's having on our communities, or the issue of older adults and parents, and issues like neglect by parents or caregivers who have been consumed by their substance abuse, and it's impacted their care of their children. As you can tell by the numbers, no one is spared. That substance abuse affects every age group. But as Apostle was saying, it is one of the other issues that has a profound and drastic impact on our young people. And we're going to talk a little bit about that today, not just substance abuse and the things that we want to look for in regards to addiction and diagnosis of addiction, but also the impact of trauma on substance use and vice versa. So with that, we'll go ahead and get into the first slide. So fundamentally, when we look at substance abuse, we're talking about a set of conditions that are associated with the consumption of mind and body altering substances that have a negative or profound impact on health outcomes. Substance use has become not only a way of coping with the circumstances of life, but also a way of finding a sense of comfort, peace, joy, depending on the drug of choice. But to elevate our sense of feeling both physically and emotionally, not only to cope with difficult events, but also to gain a sense of pleasure. And we'll talk a little bit about how the drug impacts our mind in that particular characteristics. But substance use is having a major impact, not just on individuals, but on families and on communities. The effects are cumulative in the sense that it's one of those things that I think is extraordinarily insidious in the sense that we may drink once a night, once or twice on occasion. People may smoke or get high once or twice on occasion and think that there's not a profound impact. But it's insidious in the sense that we can start off in a very minor sense and think that it doesn't have an impact or it doesn't have a problem. And over the course of time, we see how it takes more and more ground and more territory in our lives, and can influence the way we operate in our day-to-day lives, the way we relate to other people, the way we carry out our functions and duties during the day, and can create dependence, which we'll also talk about, in which our mind and body becomes dependent on whatever substance it is to operate. But as we can see, there's been profound impacts across the board in respects to teen pregnancy, the acquisition of HIV, AIDS, or other sexually transmitted diseases as the substances impact our judgment and decision making. Issues of violence or domestic violence as substances lower our inhibitions, our ability to control our decisions, make us more prone to emotional or overly emotional reactions to circumstances that may not require strong emotion. The issue of child abuse with parents and domestic violence, engagements in crime, even suicide and homicide. It can be consequences of substance abuse as they alter our understanding of ourselves and the understanding of the circumstances we engage in. So let's move a little bit just after it's a kind of a definition of substance abuse to look at addiction in the sense of any substance, alcohol, marijuana, cocaine, any of those things, becoming so much a part of our lives that it rules and kinds of directs the way that we function in our day-to-day activity. Next slide, please. So when we look at addiction, what addiction is actually is a physiological or psychological inability to stop consuming a substance or drug, or even an activity, even though it causes psychological or physical harm. So we can tell that something has its addictive properties when we are experiencing the consequences of that particular substance or engagement in that particular activity, but that doesn't prevent us from continuing to consume or work out our life in a way to access those substances. Part of the reason that, and granted, I think we need to see addiction for what it is, not only a psychological illness, but a physiological illness as well. And something that people who are addicts don't have the ability to just stop doing of their own free will. And the reason for that is biochemical in a lot of respects. Substances have a direct, intense impact on the reward system of our brain. So that part of our brain that is responsible for triggering the pleasure principle or the pleasurable experiences that we have are not only tapped into by the joy that we find in certain activities, but also the substances have a direct, profound effect on that area, affecting the neurotransmitters like dopamine that are responsible for our perceptions. They heighten our perceptions, our sense of smell, our sense of taste, how vivid things become to us, how intensely we experience emotions, and other neurotransmitters that are impacted by the broad base of drugs that we might utilize. It's sort of interesting in the sense that the use of substances is reinforced by what takes place in our brain when those areas are activated. It's sort of like, just to go back to Psychology 101, it's almost like classical conditioning in the sense that I don't know if everybody remembers the whole Pavlov dog example, where the food that was given to the dog was associated with a bell that was rung just prior to the dog being fed. So the dog would hear the bell ring, and they get food, and then over the course of time, as those two are paired, all the dog had to do was hear the bell, and then they would start salivating because the bell was associated with food. And I think a lot of similar things happen in regards to substance use. We use the substances, we get a pleasurable sensation in our brain that is reinforced over time, and then sometimes it becomes just being in the presence of people who are using, or passing an area in which we used to use, maybe a park for kids where they would get high or spend time with friends and use drugs, or a smell or a sensation that was familiar with the use can stimulate cravings and activate people's brain in the sense that prompts them to want to continue to use. So there's very, very strong physiological components that take place that not only prompt but continue to propel use of substances. There's obviously the reward of the use that gives a sense of comfort or a sense of pleasure or a sense of peace or something along those lines that we also want to replicate and sometimes can become dependent on. That high that people experience is just very reinforcing for people, particularly if it then takes us away from maybe the more difficult emotional experiences that we may be going through in our lives. And sometimes, in some respects, we can see sort of the precursors to substance use in those who have more struggles with issues like impulse control, or when there's an issue sometimes of postponement of gratification, or people have difficulty putting off rewards till a later time, that may be an indication that they may be somewhat more prone to the substance use because of the immediacy of the gratification that comes from using drugs. So in the DSM, actually, gambling, which also has that similar effect in the brain centers, is also included actually in the DSM-3 in the substance abuse or substance use and addictive behaviors section of the DSM, because gambling seems to hit those same centers of the brain and create the same kinds of cycles that we see in those who abuse substances. Even though there are other behavioral addictions, for instance, we're seeing more internet gaming kinds of addictions, or sex addictions, or shopping addictions, or things of that nature. Even though they have similar characteristics, there's not been enough peer-based evidence, peer-reviewed evidence yet to be able to include those actually in the addictive-related sections of the DSM. But I would not be surprised if many of those don't start to enter as we get further and further into the future, because of the impact also that they're having on the pleasure centers of the brain, and those of us who struggle with these kinds of issues. Next slide, please. So this is kind of a high level review of the substances. So we won't get into the nitty gritty of particular substances in this time period that we have together. But for the sake of sort of consolidation and looking sort of in a broad based sense of what kind of drugs we're looking at, the classifications include depressants, hallucinogens, stimulants, and opioids. And we need to know that both legal and illegal substances can be the source of addiction. They're not just restricted to illicit drugs like heroin or marijuana or cocaine. We are struggling now a great deal with the use of prescription, of the excessive use and addiction of prescription medications, which has become an issue for people in the course of the past 10 years, even though it's probably been there, it seems to me. I don't know if our dependence on pharmacology has had any influence, but that has also become a more profound issue for those who are struggling with addictions. So in regards to depressants, we're talking about substances that impair the activity of the central nervous system. They have the ability to make people feel calm or serene or even drowsy. We may see side effects such as slurred speech, dizziness, a loss of coordination, a loss of reaction time, things of that nature. And alcohol is obviously the most widely abused depressant in the world for some obvious reasons, because it's a legal substance, at least for adults. But from a social aspect, it's much more acceptable in our community, but it's as deadly and has probably the most profound consequences of any of the substances of abuse, particularly in regards to its ability to precipitate accidental death, motor vehicle accidents, impairments in judgment and decision making, in which people take unusual risks or engage in unusual types of behavior that can lead to injury of themselves or others, or obviously an early demise. And it's not unusual. I mean, obviously for some to take the edge off of their day with a drink or two at night after a difficult day at work, or to get together for social gathering with friends and have it enhance what takes place in a social setting with other people. But the insidiousness of alcohol is very profound in the sense that the power that it has to precipitate significant lapses in judgment. And obviously, as it being a depressant, though we may feel that it gives us a sense of comfort and relief, it also has the impact of depressing us to a sense that that is to a degree that's much greater than any kind of depressive symptoms that we may have been experiencing before the use of alcohol. And one of the other substances that we're really struggling with as a community is opioids. Opioids block the sensation of pain by binding to the brain's opioid receptors. So they are used as an analgesic in pain relief. So much like alcohol, because the substances are oftentimes given by prescription, whether they be the hydrocodones, Vicodins, fentanyls, Oxycontins, things of that nature, are prescribed by a physician for pain. They're also a drug of abuse, obviously, because of their properties, their ability to make one feel serene and peaceful and calm. The illicit substances are those things like heroin and other opioids that obviously are profoundly detrimental, whether they're being used through snorting or injecting into the bloodstream or smoked in any way, shape, or form. They're extraordinarily detrimental and extraordinarily addictive. Their consequences are profound in the sense that I think we're up to an average of, about 70,000 overdoses a year, with 70% of those overdoses being related to opioid abuse. And even in my work, I've seen people go to profound lengths to access these substances. I've had patients who have been involved in doctor shopping and seeing a number of different physicians and getting prescriptions from a varied number of physicians in order to obtain enough substances to utilize for a high, or even stealing prescription pads to be able to forge their own prescriptions. It really has the impact of not only profoundly altering people's physical and psychological functioning, but leading to behaviors like crime, which has obviously detriments for the person in the community. Another classification is the stimulant classification. Stimulants enhance the central nervous system activity and has the potential to enhance our arousal. A memory and attention is improved. It reinforces the positive experiences we have. It really kind of amplifies the positive sensations that we experience. So, taste, smell, sensation is heightened. Any pleasurable sensation physically that we have is heightened through the use of stimulants. And so obviously they also become a profound drug of abuse. It has similar challenges in the sense that as we are providing prescription stimulants as well in our healthcare environments in regards to like the treatment of attention deficit and hyperactivity disorder. We're utilizing stimulants like Ritalin or Concerta or Adderall, which also, though they're being used for appropriate purposes to heighten a child or a student's focus and attention, their ability to concentrate and stay locked in at school, to maintain their attention span for longer periods of time. They are also abused. They're abused by children and sometimes by adults to amplify their experience. We're looking at issues in which children are maybe involved in selling their stimulant, appropriately prescribed stimulant drugs to other classmates or students who will utilize or abuse them. So obviously it's important that we be mindful of the prescription medications like the stimulants and watch our medicine cabinets and ensure that our children are utilizing medications properly in the event that they are using them and not using them for nefarious purposes or providing those to friends. One of the negative impacts of the stimulant use is not just the impairments in judgment and decision making, but excessive use can lead to the potential of heart failure or seizures from overheating or a racing heart. With substances of abuse, we obviously never know how they're going to affect us individually. All of our body chemistries are different. The way that we are structured, any physiological health concerns that we might have may not be unveiled until we have a negative reaction to some of the medications that we are ingesting into our system. So obviously those need to be observed, monitored, watched, and regulated appropriately. Another area or classification of substances that are utilized are what we call hallucinogens, which are mind-altering drugs, which give a false sense of reality, that they have the potential to alter a person's time, space, experience. Colors, sounds are created more vividly. There can be things like out-of-body experiences in which people feel like they're the dissociative kinds of experiences when they're outside of their body watching themselves or watching other people. Profoundly dangerous in the sense that they alter reality. And though they give an overwhelming, peaceful feeling for those, I think, who utilize them, the alteration of reality can precipitate really poor decisions or miscalculations about various things. Miscalculations about our powers, our skills, our capabilities, what we are really capable of doing. where I don't know that we're not seeing this as much in our practices. We're seeing the alcohol and opiate abuse and things of that nature. But the hallucinogens are still out there, whether they be LSD or mushrooms or things of that nature. So it's another substance that we need to be on alert for, that not only our young people, but some adults are utilizing to enhance their experience and sometimes alter what may be more of a bleak experience in their day-to-day lives. Next slide, please. So when we're looking at diagnosis, which is really what we're really talking about, is the symptomology of substance use or abuse. And so for a diagnosis of a substance-related disorder, whether it be alcohol, marijuana, stimulant, or opioid abuse, we're looking at a problematic pattern of behavior um, in which there's clinically significant impairment or distress, which is indicated by at least two of the following characteristics. For a mild diagnosis of, let's say, alcohol abuse disorder, there needs to be at least 2 to 3 symptoms of the symptoms that we're going to talk about below. For a moderate diagnosis of any particular issue, it needs to be 4 to 5 symptoms, and of severe diagnosis, it needs to be 6 or more. And these symptoms are broken in kind of into different sets of criteria or categories. So when we're looking at criteria A of a substance-related disorder, we're talking about impaired control over the substance use. And that involves characteristics such as the use of larger amounts of a substance over a longer period of time than intended, a persistent desire to cut down or regulate the use on multiple occasions. So a person indicating that, I'm not going to do that anymore. I'm not going to smoke anymore. I don't need that in my life anymore. But then finds themselves using again in the days thereafter. And they recognize the consequences and they're trying to stop, but then for some reason continue to precipitate their use in weeks or months thereafter. Significant time obtaining, using, or recovering from the effects of a substance. This is when people spend an inordinate amount of time focused on the use of the substance, whether that's orchestrating their day around accessing a substance to use, or if it's say recovery, if someone finds themselves being hungover in a way that they lose days, or they lose long periods of time, or they have difficulty getting back to work. That would be require a significant time in regards to the effects of the use. Or recovering from use and getting yourself back to a place where you can get back to an optimal level of functioning. Or we're looking at an intense desire or urge to use, particularly around those areas that the substance are obtained. So in this we're talking about cravings or a desire to use that's overwhelming, where there's a preoccupation with when the person is going to be able to use again, or regardless of the circumstances, they find that they have to use again because the desire is so strong. So all of that criteria is filed under the issue of having impaired control over the substance or over their use of the substance. The second criteria has to do with social impairment. So when use results in a failure to fulfill obligations like work-related obligations, school, this is the student that doesn't attend class because they're staying in their dorm room to use, or they're staying with their friends to use rather than reporting to class. Or the person who can't seem to get themselves to work because they want to use or are involved in use. Or persistent use despite recurrent social or interpersonal consequences. So if a person is finding, for instance, that they're involved in a lot of conflicts, and the common denominator in those conflicts is that they were using either at the time or just prior, to the conflicts. There may be an indication that the substance use is a precipitant or somehow impacting that use and impairing their ability to relate interpersonally, whether it be with partners, friends, children with their parents, with spouses, things of that nature. And also that important social or occupational or recreational activities may be relinquished or reduced related to the use. I think of the athlete who has been an athlete most of their life, and interscholastically they decide suddenly that they don't want to play football or don't want to play interscholastic basketball anymore, so they can spend more time with their friends using. Or a student that's involved in clubs or activities that's always given them joy, but they've been willing to relinquish that so they can spend their time engaged in either use or activities surrounding use or social clubs or friends groups that are characterized by use and substances. So criteria B is around our social impairment, ways that we relate to others that are being impacted or profoundly negatively impacted by the substance of abuse. Criteria C has to do with risky use or risky behavior. This is when people who utilize or abuse substances continue to engage in the use despite the consequences that they experience. For instance, the physiological consequences that they experience. For instance, the person who is suffering from cirrhosis of the liver that's been directly related to their alcohol use. They've gotten a diagnosis, they've had diagnostic tests, they are aware that the use is impacting their health and their liver functioning, but yet and still they continue to use, or they find reasons or rationale for continuing to use, or using in physically hazardous situations. You're on a job that involves sort of dangerous types of work, but that doesn't prevent you from using, even though impairments in reaction time and judgment could lead to injury of yourself or another person. Failure to abstain despite the difficulties that are related to use. So when we experience consequences related to that, but that doesn't impact our willingness to use or our ability to use, is also an indication that we might be struggling, or someone that we love might be struggling with a substance abuse related issue. Next slide, please. Next criteria has to do with pharmacology or tolerance. And tolerance, what tolerance is requiring a markedly more of a substance to achieve the intoxication or the desired effect. So the person that maybe felt, a buzz when they drank 2 beers, and now has been drinking to the point where to get that same sensation, they have to drink 6 beers. The person is building a tolerance. It also indicates markedly diminished effect with continued use of the customary dose. So if a person was accustomed to having a 6-pack of beer, for instance, but now they don't get the same sense of relief from a 6-pack of beer that they got initially when they started, the person is building up a tolerance. You think about, college age students, who sometimes will brag about being able to drink their friends under a table. Well, that's not a good thing. That's an indication that there might be a problem. If your friends are getting drunk off of 1 or 2 beverages, and it takes you 6, 8, 12 to be intoxicated, that's an indication that a tolerance has been established, and that there's likely an issue. Same thing with marijuana. If someone is smoking and it requires, 3, 4 joints or whatever it is that the person smokes in order to attain the same high that they attained previously, that's the indication that a tolerance has been built, and that's a dangerous place to be. As is with withdrawal, in the sense that the body develops a dependence on a particular substance, and any reduction in the blood tissue concentrations uh, 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 precipitates a physiological, a negative physiological response to the withdrawal um, uh, uh, of that substance. And these withdrawal symptoms can vary across various substances. But with alcohol and opioids, withdrawal symptoms are very dangerous. Some of the withdrawal symptoms of alcohol include sweats or a heart rate uh, uh, that increases above 120 beats a minute, hand tremors and the ability to keep one's hands steady, insomnia, nausea, or vomiting, visual, tactical, auditory hallucinations. Sometimes people feel like bugs, what they feel like bugs on their skin, or a crawling sensation on or under their skin, seeing things or hearing things that aren't present, psychomotor agitation or restlessness and inability to stand, to be still or to settle and have any sense of peace, anxiety, even seizures and elevated blood pressure are all signs of alcohol withdrawal, which is an indication that the body has become dependent on the substance over a prolonged period of use. This is much more likely in adults who have been drinking over longer periods of time, and much less likely to see in a young person unless they're drinking at a really high rate. Opioid withdrawal can result in despondent or dysphoric mood, nausea or vomiting, muscle aches, teary eyes or running nose, dilated pupils, goosebumps, diarrhea, yawning, fever, insomnia. Opioids give a sense of peace and tranquility, and the withdrawal symptoms will be exactly the opposite of that. It'll be like a body that's going haywire. Oftentimes, people say that it feels like a profound case of the flu, in which there's muscle aches and cramping and diarrhea and nausea and those kinds of things. So there can be profound physical effects to dependence on a particular substance. Next slide, please. So in regards to substance abuse and trauma, it's a very complex relationship, in the sense that trauma can increase the risk of substance abuse, just as substance abuse can increase the likelihood of experiencing traumatic events. Trauma increases the likelihood of substance abuse, in that people turn to substances of abuse to self-medicate, to find a sense of comfort and peace, to get away from the memories and the experience of the trauma that's been impacted on us emotionally, physically, relationally, due to the traumatic event that we experienced. It's a way of managing the distress that can be associated with a traumatic event. Alcohol and other substances are used to manage the intense flood of emotions that come related to the trauma, and particularly give us a sense of maybe a sense of numbing, as well as almost an emotional anesthetic that helps us kind of escape the traumatic events. Interestingly, I saw some research that a person will begin using alcohol or drugs 76% of the time after a traumatic event. So there's a high rate. And I think I mentioned this previously in talking about my experience with the drug courts, just how many participants in that particular level of intervention had experienced trauma prior to their intense use of substances. So it's a coping strategy. It becomes a coping strategy for people who experience traumatic events, but also has the potential to profoundly negatively impact the physiological, emotional, and psychological health of those who are using them, but also precipitate further traumatic events. Substance abuse increases the likelihood of trauma, in that it increases our engagement in risky behavior that can result in injury to ourselves and other people, whether that be things like driving under the influence that leads to accidents, or fights or interpersonal conflict that is precipitated by substance abuse, putting ourselves in dangerous situations, unsafe sexual encounters, being with people who are unsafe, taking particular risks, a sense of self-harm, or not caring about ourselves enough to take good, profound care of ourselves, and putting ourselves in risky situations because we no longer care about our safety and our well-being to the degree that we did previously. And substance abuse also has the potential to interfere with recovery from trauma, in the sense that um, trauma informed care and coping with traumatic events are going to require that we actually face those events face to face in a treatment setting, with all of our faculties available, with all of our mind and our memory and our access to those emotions, with the ability to construct um, effective coping skills, to utilize the information that we receive in therapy. And all of that is undermined if we are either under the influence of substances, or we're preoccupied with the use of substances, or we never get to a genuine place of healing because we are using those substances to self-medicate. Self-medicating just has the ability to exacerbate the problems that we already experience. So there's this um, negative interplay between trauma and substance abuse that that needs our attention. Next slide, please. So just to bring to a conclusion, sort of our talk on substances, and I apologize. I know I've had to move through this really kind of quickly, but successful treatment of substance use is going to require a multi-level approach. One thing that I didn't put in here that really kind of goes without saying is that in order for anybody to really get sound fundamental treatment, they're going to have to abstain from substances. They're going to have to be at a place where they can detox from any potential withdrawal symptoms, that they can become clean of the substances that they use, so that they are more clear thinking and organized. But there has to be a period of abstinence, I think, before anybody can utilize effective treatment interventions to be able to address the use of substances. And in the multi-level approach, that involves individual therapy, in which we help the person identify triggers that lead to cravings and potential relapse, so they can be aware, they gain some self-awareness, and be able to utilize information in a one-to-one setting. Group therapy, in which common problems and challenges are discussed, both about substance use and PTSD, in a community setting with other people who have experienced similar experiences, who we can garner information from, who can also have get support from, because oftentimes it's not unusual for us to feel like we're the only ones who are having these experiences. Family or couples counseling, in which family members can be educated regarding both the diagnoses about trauma and about substance use, and they can support that person who is struggling with those particular issues. But it's I think it's really important for family members and those close to have some sense of awareness about these conditions, so that they can be the best possible source of support. The involvement in 12-step programs like AA or NA are often beneficial, and they help the person in recovery gain strength and inspiration from the fellowship found in other people who have struggled with these experiences, who are overcoming, and who have some period of sobriety under their belt and are able to assist the person in their early walk with managing substances of abuse. And then in some instances, medication-based therapy. The person oftentimes has to detox from a substance that needs to be done in a safe arena, with the use of appropriate medications that help the person's body reach a point of equilibrium until it can kind of do things for itself. And then issues like for opioid addiction, we have centers like medication-assisted therapy settings, in which people get individual therapy, group therapy, but they also get medications like Suboxone, which help alleviate the cravings and the desire to use substances. Okay, and so uh, uh, assisting people who are struggling with substance abuse and trauma requires trauma-informed care, first and foremost, a sensitivity to traumatic experiences and work on that. And then obviously the substance use education and information and self-awareness that comes in helping people understand themselves in a way that help them to gain a sense of sobriety and reach their potential. I know we went through that slide kind of quick. I had some resources at the bottom, but we can also either put those up or people can review them if they want to review the talk again, or maybe I can answer some questions in that regard when we get to the Q&A of next week. So with that, I'll go ahead and bring my section to the close, and thank you so much again for participating.
All right. Awesome. Yeah, it was quite a bit to digest, but I think for the most part, the audience, families, inclusive of children or perhaps parents or parental figures that may be struggling with addiction or codependence or challenged in some way by it. As you were talking, I'm kind of starting to process it and categorize that this traumatic experience consistent with addiction will affect families primarily from an emotional perspective, from an economic perspective, from a legal perspective, and then just from a medical paradigm as well, because of the long-term abuse and how it can debilitate your health, or just the psychological ramifications from, using the uppers or the downers and all the various things available to really just lead to a person's demise. But Dr. Mark, before we go, just in your years of operating in this realm of profession, if you had to highlight maybe 2 to 3 of the major contributing factors to abuse of drugs, albeit illegal or prescribed, if it's possible, what would you say are some of the prevailing things that drive this categorically?
I would probably say family dysfunction is one.
Okay,
family dysfunction is one. Trauma, physiological, emotional trauma is probably number 2. And then I think the issue of I don't know if I categorize it as self-esteem or coping.
Okay.
I think people struggling with their sense of identity and who they are and their own sense of value and self-worth, I think precipitates a need to alter that dysphoric kind of feeling that people experience internally when they don't feel like they have value.
So low self-esteem, self-loathing, things of that nature, where it kind of just like a rejection of who I am as a person, or just a disdain with certain aspects of my life that could lead to seeking to, as you said, get into some euphoric realm to escape what may deem to be his reality. Wow. Okay.
Absolutely.
So dysfunction, which is the gateway to all kinds of issues, and then traumatic experiences or episodes, and then the whole issue of just esteem, a person's worth and value, and all those things can be perpetuated or either just cut at the root through the family unit. I was thinking in terms of like with children that grow up in homes where there's addiction and abuse of drugs. What is the likelihood of them actually getting involved in drug abuse or some other just aspect of life that disturbs them emotionally or impedes their development?
Extraordinarily high. I mean, I don't have the direct numbers to wrap around it, but if you think about it, our home and our family and our parental units is where we establish our understanding of the world. Is the world going to be a nurturing place that's going to take care of us and look after us, has our well-being in mind and our safety and security in mind? Or is it someplace where we learn that it's really kind of dog eat dog and we're responsible for our own well-being, or that the world is an unsafe place and we need to protect ourselves against that? Or that this is all that we have to aspire to, that if life isn't going to get any better than this and it's not going to be any hope, I'm going to make the most of the time that I have here. And if that requires me altering my experience to have some sense of tranquility, peace, joy, excitement in this life, and substances are the quickest way to it and the most rapid access, then that's going to be an option for me.
Wow. Very good. Thank you for your time, Dr. Mark. I know it's been a long day for you, so we appreciate you.
You're very welcome.
To the audience, 11:59 p.m. Central Standard Time, time stamp. The last the last of the questions that we will even consider via email. And this Friday at 10 a.m. Central Standard Time will be our final session. It'll just be comprised of some of the questions that have been emailed in, where Dr. Mark will take time to provide some thorough answers. And then there's going to be just also some resources available to maybe tailored towards some specific aspects of some of the items that you've been discussing from a traumatic experience that deal with disorders, how people can just some natural resource, well, some professional resources that you can utilize. So if you have questions, I saw one, how can you help people in these situations, especially if they do not want help, instead choose to self-destruct? That's challenging. And then another one, so how can we access the information from the slide? So the videos will be up. I encourage you to review them and capture as much of it as you can before we take them down and store them for later use. But anyway, the cutoff time will be 11:59 p.m. Central Standard Time tonight for all questions to be considered. And then those that we can't answer on the live, we'll do our best to respond to your email with a resource or perhaps an answer tailored specific to your question. So, Dr. Mark, thank you. And to the audience, thank you all again for coming on. Share this with some of your family and young people you may know. Just encourage them to watch it and just to get some clinical insight into the inner workings of addiction and some of the catastrophic things it produces for people. But I like the three areas you mentioned that lead to abuse: family dysfunction, and trauma, and esteem issues. And we know that through a personal relationship with Jesus, all those things can actually come into alignment and really experience perfection. It takes time, but it takes intentionality with that time as well. So thank you once again. You all have a great evening. And Dr. Mark, we will see you Friday morning, 10 a.m. Central Standard Time. Appreciate all of you. Have a great evening.
God bless.
All right. God bless.